My name is Sister Patricia Spade. I'm a Franciscan missionary sister for Africa, and I come from Ireland. I was appointed to Nakuru in Kenya by our congregational leader in 1997, and I was asked to look for the needs in Nakuru. So during that time I was accompanied by a volunteer who showed me around all the very, very poor and marginalised areas in Nakuru. And that time I was to look for the biggest needs. So following the 6 months needs assessment, the biggest need was people wanted a community home-based care program for people suffering from HIV and AIDS. Because at that time, HIV and AIDS was rampant in the community and people were suffering a lot and left to die because there was no antiretroviral treatment. We started our program in that little tiny room under a tree in 1997. And I called the program Love and Hope because I felt that this is what God was calling me to do for Him and His people. As the years went by, you can imagine the needs changed. The basic thing was the HIV and AIDS, which is still with us today. But there are many other needs now that have cropped up and we have now reached out to. So a lot of people today are suffering from cancer. They're the very, very poor people that don't have any money even to get the basic drugs that are required, the radiotherapy, the chemotherapy. And actually they come to us in tears asking, please, please try and help me. Try and help me because I want to be able to live. I want to be able to give my children a life. But if I have no help, it means I go home and I die. So we follow the people up in the homes. We try to see if they can also help us so that we can help them. So it is one of the very, very big needs in the program.
We've known the Love and Hope Center as an organization that has been helping us with our patients in so many ways, because here we see the cancer patients, and Love and Hope have come in handy to help some patients in paying for their NHIF. They've paid for some patients for surgery. They've even helped some patients to get treatment for the condition that they have at Nakuru Level 5 Hospital. From 2018, the inception in May up to December of 2018, the numbers by then, they were not very high. We were doing between 10 to 15. But the beginning of 2019, now people knew so much about the center, and we started interacting with you and welcoming you to the hospital in case we had anything. So from 2019, the numbers rose triple that. And then in 2019, 2020, 2021, the numbers again rose to almost double that. So right now you are helping close to 120 patients from the Nakuru Level 5 Hospital. Yes. The burden in Kenya is, right now it's still quite high, even if we compare our numbers with GlobalCan, because we are capturing much of the disease in stage 4, where there's less for us to do. Yes, there's something for us to do, but we are going to reduce the quality of life if we had captured the disease earlier.
I was feeling sick, going to the hospitals, being given different medicines, but no change. Now it came to serious, but we didn't know what is going on. When I was where I am selling my fruits, I met Sister Patricia. Sister Patricia asked me, why are you sleeping in the job? When you are in job? And I said, no, I'm not feeling well. And then she said, can you know Love and Hope? I said, yes. She told me, go Love and Hope, you will meet Sister Irene. And then talk to her. The following day in the morning, I went to Love and Hope and I got Sister Irene. She gave me a warm welcome. We talked. We discussed how I have gone to the hospital, and then she sent me to PTH in medical. I went medical. I met a doctor, and then a doctor treated me first time, second time, third time. He sent me to Gyn. Gyn came and visited me. He said to go to biopsy. I went to biopsy. On last year, 2020, July, date 18, the results was out, and they said it's a CA vulva. They referred me to oncology. I attended clinic 2-3 times. They refer me to Kenyatta Hospital for radiotherapy and chemotherapy. It was a long journey. I had time for me. Looking for transport, it was hard. The chemotherapy, I get the support from Love and Hope, and I thank Love and Hope very much for their support for me. Love and Hope, with the Sister Patricia, they were very close to me, visiting me, buying medicines they bring for me, taking care of me, and following up every now and then to know how am I going. I was with the big wounds. They supported me. They do dressing for me. Everything they do for me. Up to now, I'm still going to clinic in Nairobi, and they're still taking care of me. Personally, can say the beneficiaries of the Love and Hope, I can say they go on supporting Love and Hope because they assisted me, and there is another one somewhere who is suffering like me, and he don't have any, or she don't have anything to be supported with, because cancer is a long journey. It is not easy, and it does not take the smallest part of money. It takes a lot of money. So whoever is somewhere who can support Love and Hope, support it. Please support it on my behalf. I say there is another one somewhere suffering the way I was suffering, and their beneficiaries would be supportive for them. Please support them.
Well, I would love to appreciate everybody who has come in handy at the Love and Hope Foundation. We really appreciate what you are doing for the foundation. You have helped so many. We would love to appeal from all of you. You have helped so many. Some of them even right now they are cancer free. For our well-wishers, what I'd request you to do, whatever you are doing is remarkable. We cannot even be able to pay you back. And we would hope and wish that you continue with the same, because you have helped so many. Not only the oncology services that are here and way beyond what we can be able to give at Nakuru Level 5.
To the local community and to the wider community, please help us to be able to help the people. And I'm really begging you, because at the moment we're in a dire straits. Donors have pulled out. During this time of COVID-19 last year, it was one after the other without any preparation, without any exit strategy, nothing, because they were now dwelling in their own countries, trying to help their own people. So today I am begging you, please, please, if you want Love and Hope to continue, if you want us to be able to go out and serve the suffering people, and as you all know, Jesus is in the suffering people. When you give to us to be able to help the people, you are touching the life, God's life in that person. So I plead with you, I'm just pleading you with the bottom of my heart, unless you help us to be able to help the people, we are not going to be able to continue. Do you want us to continue at Love and Hope? Do you want us to keep serving and helping the people that God has called each one of us at Love and Hope to serve here in Nakuru?